Well, good afternoon, everyone. At least if you're on the East Coast, good afternoon. Brandon Garrett here with the National Minority Equality Forum. With our Friday panels, we're trying to educate a little bit about what's going on in the world, especially in the world and around health and health disparities. This program will be led by our very own Akeia Blue. She is great, and I'll let her do all that stuff. You know, you've met her before, you've heard her speak, you've heard her do presentations. I think she did this about a month ago as well. Not this particular one, but she's led one of these a month ago. I'll just give you a few things to think about. If you have questions and answers, if you want to ask a question to her or anybody on the panel, please type that in the Q&A box. And if you just want to carry on and have a chat and talk to your fellow participants, please put that in the chat function. And if there's any thing you wanted to let us know about and all that, you can put that there as well. One big announcement that I have is that our annual Summit on Health Disparities will be April 29th and 30th in Washington, D.C. And if you're interested in joining us in D.C., please let us know. We'll put the registration link in there. And without further ado, Akeia, I'll let you go ahead and take over.
Great. Thank you so much, Brandon, and good afternoon or good morning to everybody on the call. We're very excited to be talking today about community partners and collaboration within communities. This webinar is for the Center for Sustainable Healthcare Quality and Equity, which is one of our centers here at National Minority Equality Forum. And so they do some really great work working with community leaders and clinical leaders to promote health in communities. And we'll drop the link to their website in the chat if you want to check them out and learn more about them. So as Brandon said, I am the Health Communications Director here at the National Minority Equality Forum within the Center for Communications and Public Affairs. Today, we are going to be highlighting the collaborative efforts of the Center for Sustainable Healthcare Quality and Equity, its communities and health partners in Birmingham, Alabama. We all know that community partners are pivotal in the health equity space, actively engaging in community education on crucial health topics, offering direct support through impactful events and programs, and also advocating for systemic change while doing all of the other work that they do. And so today we're going to talk about the power of collaboration and the indispensable role that these community leaders have played in fostering positive health outcomes and driving change. We are going to set the stage for this this discussion in the historic city of Birmingham. Of course, it's Black History Month. We're closing in on the end of Black History Month, and you can't really talk about Black history without bringing and acknowledging the importance of Birmingham. Of course, it was once known as the most segregated city in the country, and therefore led to our civil rights leaders selecting it as the seat of the civil rights movement. And it's also worth acknowledging that we're coming up on 60 years since the passage of the Civil Rights Act in 1964, July 2nd, I believe, 1964. So almost 60 years since we legally said that desegregation cannot exist anymore. And we said that there is no discrimination based on race, ethnicity, et cetera. But we still see the longstanding implications and negative health outcomes that have resulted from forced segregation, from the policies that were in effect in that area and in that era, and many that are still continuing even to this day. And so the discussion, I'm very excited for us to talk about this and what Birmingham looks like now. You know, as a city that had such an important role in the civil rights efforts, we would hope to see that the health outcomes and the outcomes in general for Black people would be really good, but that might not necessarily be the case. So I'm going to introduce our wonderful panelists who are all community leaders in Birmingham. And gonna have them each kind of answer this initial question as I introduce them. So I'm gonna start with Sean Poe Williams, who is the CEO of eCure Health and Wellness Practice. And so Sean, as we just mentioned, you know, there's a lot of implications, negative health outcomes and increase in health disparities, and that often results from segregation. So curious to see what concerns you're seeing through your work.
The biggest concern is the segregation, because that determines the health outcomes for a lot of people in minority communities, because in those particular communities, that's where the resources lack. There has been recently some studies that are showing that the lifespan for those individuals in those communities are a lot shorter, 10 years or so shorter than other predominant communities. And so it's just, it's still a daily grind and struggle to try to figure out how to help in those communities.
Great, thank you for that. And we're going to discuss that even further. But next, I want to introduce Reverend LaShawn Nicole Slater, who is the lead pastor at Payne Chapel African Methodist Episcopal Church. And so, Pastor Nicole, the same question for you. What are the biggest concerns you're seeing in your work?
Greetings. So grateful for this opportunity. And yes, segregation in 2024 has a different appearance. So while Birmingham specifically has made several strides, so many positive strides, toward equal civil rights and equal liberties, for all people, there are still so many disparities and so much lack, as Sean mentioned, in our predominantly minority communities. Payne Chapel is situated in Titusville, which is historically, Black, on the other side of town. And some of the things that we see, has to do with access to healthcare, and the intentional efforts of the health systems removing that access, removing labor and delivery from the hospital on that side of town, removing the indigent specific hospital, from the main thoroughfare of the healthcare center in Birmingham. And then transit, like public transit, decreasing routes, long appointment times, and then increased barriers with health insurance and long times for appointments. So there are so many factors, but segregation has a primary role in it because the new name for it in 2024 is gentrification. And so as we continue to rehab, our communities, we're now denied access to our communities. So even though they're redeveloping and they're bringing in new services and new healthcare initiatives, our folks are now being displaced.
That's a word right there. We're going to keep talking about that in just a moment. Dr. Coretta Collins is also joining us, and she is a nurse practitioner at the University of Alabama at Birmingham Hospital and the owner of the Confessions of a Nurse Practitioner blog. And so, Dr. Collins, what are the concerns that you're seeing?
So similar to what Pastor Nicole and what Sean have already stated, but I'll say more specifically, because I do happen to work with the largest health institution in the Southeast. And we constantly, see, and I see like on a daily basis, the number of people who I encounter who are either have no insurance or are underinsured. Most of the time they look like me, or they're going to be Black or brown people. And so it forces us to dig a little deeper to see like what exactly is the issue. And just like Pastor Nikki mentioned, we've noticed the different decrease in access to care and access to resources. A lot of it comes down to socioeconomic status is what we end up seeing. And in our poorer communities, that's where, instead of trying to increase the amount of resources, which we do have some people trying to do that. However, money talks at the end of the day. Specifically, I work in oncology and hematology. So I take care of people with cancer and blood diseases. And so even with that, I see higher disparities across the board, where Black and brown people were diagnosed later, we get healthcare later, we have the higher mortality rates. And this is for like most of the cancers, and a lot of the blood diseases. And so those are some of the things that we still see, even though we've like made some strides, we still have a lot of work to do.
Thank you. And so I'm hearing, access is a big issue, disparity in care in terms of higher mortality rates for cancer, as you mentioned. It's also worth noting that Birmingham, southern states, so obesity levels are high in southern states, things like that. So there's a lot of disparities. What would you say, and I think maybe we can start with you, Pastor Nicole, what are the biggest things that you hear from your congregation that they're concerned about regarding their health?
So we have a lot of genetic stuff going on, you know, and there is a low expectation for positive outcomes. I think I'll phrase it that way. You know, folks know that their mom or their dad died of a heart attack, or, you know, Big Mama had diabetes, as we like to say, sugar.
Mhm.
And they just know that at some point it's gonna come to them regardless. So there's no point in preventive care. There's no point in changing their lifestyle or their diet. And everything seems so far away, you know, far in the distance, that it's not reachable for them. And so bringing them the resources, bringing the education to them, bringing meal prep instructions to them, bringing resources for fresh food, because in our communities, there are no grocery stores. So, you know, it's hard to get fresh fruits and vegetables from Family Dollar and Dollar General. And so fast food is easy, it's quick. And the chicken joint down the street, you know, all of that is accessible, but it's not beneficial. So for us to be able to bring those things to our folks, I've seen the light come on. You know, I've seen them say, "Oh, wait, maybe I can do this." And I think that ignites a glimmer of hope, you know, in some folks. But primarily the genetic stuff that seems overwhelming, that they cannot conquer, and the lack of hope that things can get better for them.
Yeah, and Sean and Dr. Collins, I know that you both are coming from a clinical perspective. Is there anything else that you want to add on in terms of the health concerns that you're seeing beyond what you've already mentioned?
I think one of the biggest things is the lack of education and awareness. They don't know, they don't understand. And so with that comes, you know, this is what it is, and there's nothing I can do about it. Because they don't understand what's going on. And so I spend a lot of my time with certain patients, just teaching them and educating them on reading food labels, ingredients, understanding what you're digesting and how that affects you from a day-to-day. How, you know, even though you have a higher risk for developing these things because of hereditary, you can do X, Y, and Z to help with that. Educating them on medication, especially for my men with high blood, my Black men with high blood pressure, right? They don't realize there's so many blood pressure medications. And so we can try whatever we need to try until we get one that doesn't have side effects. They typically just stop taking it because, oh no, it did this, so I'm not going to take it. I said, well, if you don't, you know, have to explain, if you don't take it, this is what's going to happen. And so once you explain that there are options, there are choices, patient shared decision making is a thing, instead of dictating to people what they should do. I think it's huge when you give them options and you share with them and let them know.
Great.
Yeah, and I'll just kind of, you know, add to that. I try to encourage people to, you know, be their own advocate and to, you know, educate them more, because my motto is, you know, prevention is better than treatment. Early intervention is better than late intervention. And so with our communities, you know, there is this stigma of sometimes like not wanting to know or not wanting to address these issues. But if we can impress upon our communities even more about the importance of doing this, then we will see, you know, better outcomes. You know, a lot of times, like a lot of the different cancers I treat, they could have been prevented in many cases, or they could have at least have received early intervention. So, you know, as I previously alluded to, oftentimes like in Black and Brown communities, our cancer is metastatic, meaning it is stage 4. It is the worst it can be at the time of diagnosis. Whereas, you know, if a mammogram perhaps, or a pap smear, or a colonoscopy, had it been done in a timely fashion, if we had really been educated more about the importance of having those things, then all of that could have made a world of difference. So that's like one of the big things that I try to do is like educate and then help people kind of advocate for themselves. And, you know, try to like listen and meet people where they are, because like they've already mentioned, sometimes people, they just don't know, or you don't think it's important. And sometimes we can be resigned to what happened in our past. But, genetics definitely plays a part, but also environment and our choices also are a huge factor. And so if we can work on changing the things we can still prevent some of these things from happening.
Absolutely. And I think what you just talked about really leads us into the next point, because y'all all are trusted community leaders. People listen to you and come to you all for your advice, for your thoughts. And so we can start, Dr. Collins, since you just kind of touched on this about normalizing conversations within these communities, but how do you become someone that your community trusts also?
So I feel like, we have an advantage being Black and brown. We have, that really helps, that goes a long way with our community. I've, noticed differences in, like, if I've, sharing in a patient's care, how they interact with me may be different than how they interact with, like, my Caucasian counterpart. And it makes a huge difference, because we can relate. We may be able to convey information in a way that it is received better. So another thing is, like, I try to, like, advocate for more Black and brown healthcare professionals. Like, we need more people who look like us to help care for us, because and there have been studies too that have shown, like, an improvement in certain outcomes just as a result of having somebody who looks like you, or who you feel like is more invested in your outcomes. And so doing things like that, mentoring, or, speaking to potential, like, nursing students or physical therapists or doctors, those kind of things, I hope that I'm making some kind of an impact in when I'm doing that. And then aside from that, in general, just meeting people where they are, I found that, the Black church is still such a big hub for our communities, especially in the South. Maybe not as much as it once was, but for the most part, a lot of us are still involved in church or go to church. So churches are an avenue to kind of get the word out and to meet people where they are. Also, like, community health fairs and some of those, like, on the ground events is where you may encounter people more to kind of help promote, different health and wellness topics.
Great. And I think you tossed it over to talk about the church. So Pastor Nicole, how have you become a trusted member in your community, and what is it?
I chuckled when you asked the question initially, because Dr. Coretta and Sean both fuss at me because I tell them all the time I'm almost a doctor, because I graduated from Google University, and I'm now exploring my graduate studies at YouTube University. And they remind me, that diagnosing myself with Google will kill me in about 3.5 hours, and go from there. And so I said all of that to say, our trust in the community has come because of consistency and great quality. Our mantra at Payne Chapel Birmingham is we're better together, and we try to live that out and live it out loud in everything that we do. And so the people that we put before our congregation, as well as the community, the services that we bring, the resources that we make available to them, they're number one, top notch, top shelf, however you want to look at it. And they can trust those, they can count on it. And we don't just say it, in the moment, but it can be seen throughout everything that we do. And so whether it's a food giveaway, or a flu vaccine clinic, or over the kitchen table segment, the people and the quality, the resources, the education that we put in front of our folks, consistent and number one top notch.
Great. And Sean, do you have any special tips for normalizing those conversations as well?
Well, I'm just going to be honest. I meet them where they are. I just meet them where they are. I talk to them in normal conversations. I don't talk as a healthcare professional. I don't talk as an individual with 5 degrees. That's not how I talk to them. I talk to them on their level so that they can understand. And I think that's pretty much, I mean, relating, I think that's how I've been able to have people to trust me.
Great. And we should also note and acknowledge that all of y'all are members of Delta Sigma Theta Sorority Incorporated, and you're all repping it very proudly and beautifully today. And for those who are joining us and don't know what Delta Sigma Theta Sorority Incorporated is, it's a historically Black Greek letter organization, and part of the National Panhellenic Council, which is commonly also known as the Divine Nine. I'm a sister Greek. I'm a member of Zeta Phi Beta Sorority Incorporated, but we, I think, all love our organizations and the lifetime commitment that we've made to serving our communities through them. And so I'm curious for you all how being a member of Delta has, helped you become a trusted community member or not. If it's just something that you leverage at this point, how do you work within that network to do the work that you do for community engagement? Sean, you can go ahead and start. It sounds like you're talking.
Go ahead, Pastor Nicole. Pastor Nicole, go ahead.
Well, so there's a level of trust that comes in the fraternal and soror world, period, because of the bonds that we share. And so that has proven to be a benefit. I know it's because we stand on, tall shoulders, and the process to become is so meaningful to so many people, both Greek and non-Greek, that it's known when you step on to whatever platform it is, or in front of the camera, or in front of the microphone, and it's known that you're a member of whatever fraternity or sorority. It's like, oh wait, these people are legit. They know what they're talking about. Specifically with us, the three of us have all sat together, whether it was at Payne Chapel's Over the Kitchen Table, or a community project, because of the network. And so it's easy. Relationship, we're better together. I'm gonna keep saying it, but relationship is there. We can count on one another. We know that as swords, as sisters, that there's a unique bond that attracts us and connects us, to complete the work.
Anything else to say on that? That's all that needs to be said.
That's it.
Yeah,
and that's all, right?
She did it so wonderfully.
She did sum it up really nicely there. I mean, and just to be a member of, Delta Sigma Theta or whatever your Greek organization is, at the root of most of those organizations is service. That's what we do. And so I think it's a part of who we are, and Delta is a great extension of it. And it allows us to do different things to be even more involved in the community.
Absolutely. And do y'all have any examples of health-related programs that maybe your chapter has done that you would like to share? Something that you've been excited about or proud of?
I'm not sure about I don't want to get into the specifics of the chapter, because I think in our area there are two, and we all do collective work. But if you look at Delta Sigma Theta Sorority Incorporated, as a national organization, we have very specific objectives that nationally we explore, and healthcare is part of that. And so I think that's a testament, as well as a testimony, of our organization's commitment to make sure that equitable healthcare is fought for and won across the board for generations, for centuries. We are an empowered group of women who still function after we graduate college, to make sure that these objectives are not only known, but they get the attention as well as the help and the resources that they need.
Great. Okay, and I do want to make sure we highlight some of the work that you all do on the ground, because we are talking about community engagement. And so, Pastor Nicole, can you tell us about you just mentioned the Over the Kitchen Table program. Can you tell us a little bit more about that?
Absolutely. And so at Payne Chapel, Birmingham, our Worshiping into Wellness ministry is the primary component of how we get education and research resources to our folks. And so there's a wellness topic every month, and we have a series of segments entitled Over the Kitchen Table. The concept is most of the time when we should talk about stuff that concerns us as a family, especially healthcare, illnesses, disease, all of that kind of conversation, it's difficult. It's difficult to talk about it. It's difficult to bring it up. You have a lot of taboo. You have a lot of hesitation and fear. And so when we all come together for those family meals, holidays, and such, that's the best time because we're around the same table. But most of the time, we don't talk about it. So we create that atmosphere. With Over the Kitchen Table, we bring the difficult questions, we bring the education, and we bring it from folks like Sean and Dr. Coretta, who can break it down in terms that our folks can understand. And so we show those segments at some point during our worship experience. We have our own dedicated YouTube channel, and we bring in the testimonials. One of the, and I might be getting ahead, but one of the things that was really, really special to us in this past season has been our Gee Whiz is Cancer segment, where we explored different types of cancer, including colorectal cancer. But we had folks to talk about their journey, talk about the symptoms that they experienced, and the stuff that's not on the pamphlet that you might get, at the doctor's office. And then we bring some real life folks, who have sat on both sides as the physician as well as the family member, like Dr. Coretta. We bring in the physician, and the medical care that can come to you, even though you don't want to leave your home, like Sean. And we make it available to our folks and let them ask the questions that they may be embarrassed to ask in another forum or venue.
And the GWIZ program that you just mentioned, was that the colorectal cancer program that you did in collaboration with the Center for Sustainable Healthcare Quality and Equity?
Yes. Gee Whiz It's Cancer was one of the segments. Colorectal cancer was a large part of that. And we did bring in some other types of cancer just to balance it out and make it whole. We also partnered with eCure, with Dr. Sean, as I like to call her, but with Sean and eCure, to go to one of the largest attended outreach activities in Birmingham, so that we can show folks, even though you're coming to pick up backpacks and school supplies, and you're signing up for health insurance and property insurance, you need to take care of your person too. And so I'll let her share more about that if she would like. But we were
Yeah.
able to make a huge impact, partnering with NMQF in that event, as well as getting it in front of the folks in Birmingham. To see folks, in their gym shorts and sneakers, coming to learn about colorectal cancer and say, hey, it's not normal to feel this way, and they feel okay with that, was a blessing.
Yeah. So we partnered with the Birmingham chapter of the National Association of Real Estate Brokers, which is an organization that was founded in 1947. And their main purpose is to enhance the economic improvement for minority communities. And that particular day, that week, they had what's called a Black Summit week-long of events, and they pretty much go over the housing market in Black America. And so for that day, we had over 1,000 people to register. It was cold, rainy, it was a bad day, but we still had over 600 people to show up. And it was beautiful. It was absolutely beautiful. We had the inflatable colon. I enjoyed people walking through it and explaining to them the different aspects of the colon. I was very surprised. A lot of my individuals who were 50 and older had their screening, had done all the right things. A lot of my younger people had no idea, right? Because they don't have, no primary care. They have no idea, how that works. And so just seeing their light bulb come on when you're explaining things to them, when you're telling them about colon cancer screening and their age and family history. I also enjoyed with that particular event was making everyone aware of I just blew a blank, the test, the colon cancer test. I just blew up the blank. Cologuard test. Yes, the Cologuard test. A lot of people were not aware of that test. So we did do a lot of education on the Cologuard test.
Great.
And I would like to add, part of our partnership, I guess you can tell that the three of us work together quite a bit, But Payne Chapel, Birmingham has always also partnered with another member of Delta Sigma Theta Sorority Incorporate, and that is Dr. Hadia Nicole Green and the Orly Smith Cancer Research Foundation. We have to get this cure that is proven out of the lab and into in front of people. We got to do that, and the best way to do that will be together. And so just another way that this soror relationship is working to our benefit. We're able to explore the things that we would normally not have access to because we're already connected.
Absolutely, yeah. Dr. Green, we actually just highlight, or if we haven't highlighted her yet, we will be highlighting her on NMQF social channels as well for her amazing, innovative work that she's doing in cancer research. So I'm glad you called her out by name too.
Absolutely.
And Dr. Collins, again, like y'all said, y'all all work very collaboratively. Ooh, I struggled on that word, excuse me. Are there any other programs or events that you wanted to highlight, Dr. Collins, from your work?
I'll just briefly highlight my blog. You mentioned it in the beginning. It's called Confessions of a Nurse Practitioner, but that is one tool that I utilize to promote health and wellness and to educate. So, that's out there. And I also do volunteer work with say, for example, one organization would be the Leukemia and Lymphoma Society, where, I go and talk about specifically multiple myeloma, which is a blood condition that disproportionately impacts Black people that most people have never heard of. It's a blood cancer. And so, various things like that to kind of help, continue to educate, spread the word, hopefully shed light on these things and what we can do to help people improve upon making their health a priority and hopefully catching things before they get too out of hand. So
Absolutely. And so y'all are all on the ground, you're in the community, and you're seeing things from a different perspective than those of us who are your partner organizations who aren't there in Birmingham, seeing things the same way that you are. And, there might be other potential partners on this call. So we're curious and hopeful that you can help us understand effective ways for larger partners to support community leaders like yourself with your community engagement. So any thoughts that you can share about what support you need from larger partners?
I think a lot of times it's just the invitation, and just to be made aware. And like I've mentioned before, I think it's important, depending upon the community you're trying to engage or you're trying to mobilize. I can't say enough about how it helps to have, trusted professionals who look like you to help aid in those kind of endeavors. So, just kind of like how you all reached out about this forum, such as this is an excellent example of just an invitation to share and to help educate. So I think more of that and having more of those kind of things local as well as nationally makes a difference.
Absolutely.
It's always helpful, to engage the boots that are already on the ground marching. I agree with Sean and Dr. Coretta in that when we are proactive, there's usually a better result than being reactive. And so I would encourage those larger partners to initiate instead of waiting to jump on board. Don't wait for a moving train so that you can see how, okay, let me get on with this. This look like a good look, but create some of your own initiatives. And there's usually a better and a faster turnaround for those who already have the platform to make use of the platform for the better good of everyone. And so once you initiate and you come up with these programs, invite us to the table, provide the resources, share the platform, and we might be able to see, even a larger difference made as we continue to do what we do.
Yeah, the answer is definitely representation. And with the larger organization, it is them reaching down and saying, hey, work with us on X, Y, and Z. Because, they have a larger platform in a larger span. And so we have to get the invitation. Us going in doesn't always work out. You know, inviting a larger organization to work with us doesn't always work out, right? So they definitely have to, I think, for the most part, take the first step in wanting to work with smaller organizations.
Okay.
Yeah.
And I might be putting y'all on the spot a little bit here, but are there any specific things that they could bring? Like if they reach out, y'all start a partnership, what would be most helpful for you to continue your work, you know, and do your work in the community? Is it resources, printouts, money? Is it, you know, what types of things should partners bring to the table to help you?
Capital, resources, bodies. Capital,
All of the
resources,
above.
bodies.
All of the above. Money.
Because if we've got the money, we've got the bodies, we can do the training and we can get it out there.
Mhm.
Yeah.
I think the
Yeah.
body one is an important one too, but please go ahead, Pastor.
No, you're accurate. The bodies are necessary, you know, bodies that we can trust, you know, and those who genuinely want to be engaged. That matters because folks can tell when you don't want to do what you're doing. Money, you know, to fund the financial portions of what's needed, and then the backing. Make your name known with what we're doing. Don't just stroke a check, you know, stand with us and let us know that you support these efforts among Black and brown people, even if it's not the popular thing to do.
Good. Thank you. I want to, you know, if there's potential for partnerships, I want to make sure it's very clear on what is most helpful for partnerships.
Absolutely.
You know, sometimes we might think, oh, as long as we send them the check, then they're fine. But I think the bodies is a good call out that you need actual people to come and help and support as well. So thank y'all for answering that. And I want to just, to the folks on the call, you can start dropping. I see a few questions in the Q&A. You can start dropping some more questions in there because we're coming down to our last few questions for our discussion here. And so we'll have time to get to some Q&A. So I do want to talk to you all about your future plans for community engagement. What does that look like for you? What are your aspirations, I guess, in terms of community engagement?
I've been recently thinking about like a financial wellness and a health wellness seminar or summit, because I think they go hand in hand. And so that is one of the things that I am currently working on and will be asking my two sorors to help me with.
Absolutely.
Yeah.
Absolutely. I think for Plain Chapel, Birmingham, our community is in need of some tangible resources. We need to bring some things to the community itself, and we've maximized, you know, the support that we've gotten from NMQF, and we're so grateful for it. But in order to literally bring what's needed into the community, we're gonna need we're going to need a little bit more. We're going to need more money. We're going to need more people because the faithful few are tired. And we're going to need some names, you know, that will stand behind what we're doing to say this is a legitimate effort and we're willing to put our name on it.
I mean, I plan to, you know, continue with the various organizations I already serve with. Specifically, you know, we haven't touched on it much during this conversation, but another big issue impacting our community is mental health. So I also serve with a mental health nonprofit. It's based here in Birmingham. It's called Nurture of Alabama. And what we aim to do is to provide community education for mental health issues through sessions and various events that we curate, as well as provide like counseling services. And so when we were talking about, you know, finances, of course, that's part of what, you know, we want to be able to pay the therapist at least something because we're providing counseling services to people who need it for free. But that's kind of one of the big emphasis of that particular organization. that I work with. Also, I plan to continue. I also do work with pregnancy after loss. That's, another big issue that impacts the Black community and the Brown community disproportionately is maternal mortality and early infant loss. And so having personal experience with that as well, I try to, use my experience and my knowledge to help also advocate in those areas. So my idea, I just try to do what I can with what I have and continue to try to, work within my means or within my resources. And so that's what I plan to continue to do.
Great. And so I'm hearing a few things that we're going to work to improve in Birmingham. And I know, Pastor Nicole, you just mentioned the faithful few, and that is a concept that I think a lot of us are aware of, but maybe not everyone, but just this idea that you tend to see the same people doing community work and community engagement. And it tends to be the same people that show up repeatedly, right? And that's why you're asking for support in terms of bodies from partners and things like that, because if you have the same 10 people that you see at everything, them 10 people gonna get tired. Yes, we know that. So it's not, I trust, we know that y'all are gonna keep doing the work in the community and your determination. I'm sure we will start to see improvement in all of the things you mentioned: mental health, maternity, mortality rates. We talked about cancer rates and obesity and everything. Financial health as well, because that is very important, as Sean brought up. And so we hope to be able to see that. But overall, big picture, is there anything else that when you think about Birmingham and the historic city of Birmingham, what are your hopes for it? What are your hopes and dreams for Birmingham? And
I would love to see us more integrated.
Mhm.
I would love it because I think it will have a huge impact. All the way down to elementary from a child standpoint, it will have a huge impact from an education standpoint, I guess. If we're more integrated, they can get more of the experiences in classes and just things that they don't get in the low income areas.
Yeah. Y'all know y'all couldn't get through this webinar without a scripture, right?
Amen. Give it to her.
Are we bowing our heads? What are we?
1 John chapter 3, verse 17. If anyone has material possessions and sees a brother or sister in need, but has no pity on them, how can the love of God be in that person?
Mhm.
And so when we look at Birmingham and we look at what we're capable of, and we look at the lines of division, even within our city, what I would like to see would be equitable, accessible healthcare for those who have much, as well as for those who have little, and to balance this out sooner rather than later.
Beautifully said. And Dr. Collins, do you have anything else that you want to mention in terms of your vision for Birmingham?
They pretty much summed it up. They
Yeah.
pretty much said it in a nutshell. I will say, even though we still have a long way to go, we've also come a long way. So
Yeah.
I would like to, make sure people understand that. But of course, there's always, more that could be done. And having the resources, having the money, being able to put it where it needs to be would make even more of an impact and make even more of a difference.
Absolutely. Well, thank y'all. We're going to move to Q&A. I see a few questions in here, so I'm going to start with this first one from Ashley. Can the panelists speak about doula care? Okay. Can the panelists speak about how doula care can assist with eliminating healthcare disparities for pregnant and birthing women?
I'll speak on that when I have an 18-month-old. And I think that may be my doula. That looks like her name. So I'm a nurse practitioner, right? And I've been in healthcare 17 years in healthcare. I've worked at the same organization with Dr. Collins for about 16, 17 years. And I had my first child in 2022. And it was the worst experience of my life. It was a horrible experience. I had all of the Black maternal things that we die of, right? Preeclampsia, all of the things, hemorrhaging, I had all of the things. And the lack of education, the lack of talking, all those, the lack of education, making you aware, talking to you, treating you as if you're an individual, speaking to my husband. My husband was never greeted, he was never talked to. I think from a doula standpoint, you have that person that advocate for you because you're in a different state of mind. You're having a child. So doulas, I believe, are vital when it comes to education. Um, um, Childbirth education from the mother's standpoint, from the father's standpoint, from knowing what's happening in the actual, when you're actually having a child. I think that they play a vital role from an education standpoint, and I think it will help with the maternity rates.
Great. All right, I'm looking through these, and a lot of these questions are actually people looking to partner with y'all. So if the three of you could please drop your email addresses or the best way for people to contact you into the chat, I think that will be helpful to respond to several of these questions. For example, we have a question from Whit Hargrave, and I think Dr. Collins will be a great connection for this person who works at GSK, so GlaxoSmithKline, I believe, Pharmaceuticals as an oncology nurse, and they support community health organizations by assisting to promote patient education and advocacy, specifically in gynecological and hematological cancers. So this person is wanting to speak offline about what providers here are doing to help educate patients in Birmingham. So Dr. Collins, I think that's a great connection for you to make there.
Yeah, absolutely. I'll put my info in here.
Great. Okay, we have a question from A. Tillman asking, are there any strategies that you all have tried that other community groups can use to get the community involved? So I'm wondering if that's more so talking specifically about making sure people show up to your events and show up to get all the information that you're sharing. What strategies have y'all used?
Give away something.
Mm.
Give away what's needed. You got to be in touch with your community enough to know what they need. If it's a food desert, give them food.
Yeah.
If it's a holiday, give them something to help with the holiday. We did a flu vaccine clinic surrounded with a turkey giveaway. So provide when Jesus taught the people, when he preached to the people, he always fed the people because that's what they needed. He fed them physically and he fed them spiritually. So we can't just go and think that folks are going to respond, hey, I'm bringing good news. They can stay at home and get that. They give them what they need. And so research the community where you're going, because what works on one side of town, it might not be the same need somewhere else, and take the folks what they need.
Partnering with organizations who have a larger reach, which is why I partnered with the real estate association, because they have a larger reach. So partnering.
Great. Okay. We have a question from Sadon. Hope I didn't mess that up. Davis, Mr. Davis, how do you include sustainability into your program planning? So how do you make sure it keeps on going and is sustainable in the community?
So I give extreme kudos to our ministry leader, Shamitria. She makes sure that we have a way to connect with our folks every time we encounter them, whether it's Q&A, whether it's a survey, a QR code. There's some kind of way for us to get contact information from the folks who come so that we can remain in contact with them. And a lot of what we do will be to blast them, with an upcoming event. And we utilize technology. Technology is our friend. And so whether it's a robocall, as I like to call it, but a phone tree, email blast, text message, social media, you use all things to your advantage, and consistency is key. We can't do something once and expect for folks to come back a year later and remember the impact that it had on them. We got to be consistent.
Absolutely. Any other thoughts on that for sustainability?
Yeah, I think.
All right.
I agree, and I'm currently like on a Q&A rabbit hole here, looking at all of these questions.
I am too over here reading the questions.
Reading the question and trying to answer some of them.
We still have a few minutes too, so we'll be able to answer some of them, most of them I think we'll be able to get to. So this next one from Deidre Biles, I'm just going to ask the first part of the question and then we'll make a recommendation of connecting after that. Has anybody worked with Dr. Coster at UAB?
I'm familiar with Dr. Costa. I don't work with him specifically because I do more solid tumor and he is more on the blood cancer side. But absolutely.
Yes, so then Deidre Biles, I would recommend that you reach out to Dr. Collins directly with your question about if Dr. Coster is a good partner. She may or may not be able to speak to that, but there can be a connection there. You may have missed that Dr. Collins is from UAB. She works at UAB. So for the second question, does UAB do any work to partner with you? She is from UAB, so you can reach out to her directly.
Absolutely.
All right. Dr. Tom Ellison might be a good connection for your team. So that's from an anonymous attendee, so I don't have any follow-up there, but that's a note. I don't know who Dr. Tom Ellison is or what
I've seen
organization.
that name before.
Okay. Hopefully, anonymous attendee who recommends Dr. Tom Ellison, perhaps you can reach out via email to our speakers and provide some more information about him.
Yeah, that would be great.
Yes. All righty. So this wasn't a question from Ms. Hakim. It looks like just opportunity to connect with the Michael J. Fox Foundation. So that's awesome for Parkinson's disease. How can people get in touch with y'all? We have that. Everybody who asked about getting in touch with these wonderful panelists, their emails have been put into the chat. So please follow up with them. All righty. So aspiring nurse practitioner, Crystal Bynum. We have 2 nurse practitioners on the call and she's asking, as an aspiring nurse practitioner due to help in the community as a student? Crystal, if you want to put a follow-up, you can, but are you asking what an aspiring nurse practitioner can do to help in the community as a student, what opportunities there are as a student to start in community engagement? Yes, okay. So.
Okay, and that may be, I saw that question. I may have like typed her answer, but I'll say, my recommendation would be to, get with other people who have similar interests as you and do some volunteer work or, get a mentor. So if you're an aspiring student, depending upon where you are in the program, or if you're, already a nurse, there are a lot of different things. So I think you just need to like leverage whatever connections you have and try to get with somebody. And it also, like I say, depends on what your interests are or what are your aims, because that makes a difference too. Because if it's a particular area that you're interested in, then it's nice to get experience and work in that area, and you're going to be more passionate about it because it means something to you. Mm-hmm. So I think I may have put my email address in there, or it should be in the general chat. Feel free to email.
Yes.
Great. Okay, and thank you to Christopher for following up with information about Dr. Tom Ellison. So my panelists, there's information about who Dr. Tom Ellison is, if you want to follow up with him. And it looks like someone just put some information about Project Help in Birmingham as well. So thank you all. I mean, this is very optimistic, right? Potential for a lot of partnerships just showed up right here in this conversation. So we're coming to the end here. If there are any final thoughts, please feel free to drop them in the chat. But I want to say thank you to our panelists. It is exciting to see the work that is being done in Birmingham, and we look forward to continuing our partnership with NMQF and with each of you. I look forward to seeing the outcomes, hopefully, of some of these partnerships that are hopefully coming your way to support you with your community work. And thank you all to everyone who's attended, everyone who's been engaged, asking questions and providing information. At this time, if there's nothing else, then we will wrap it up unless our panelists, if you have any final thoughts that you'd like to share, please feel free at this time. Otherwise, we'll wrap it up.
I'm always grateful for the opportunity to work alongside NMQF and these wonderful presentations. So I thank you guys for including us in today's webinar.
Yes, yeah.
Yeah,
Thank you so
absolutely.
much for the platform. I really appreciate the platform and the outreach.
Absolutely. Thank you all for your incredible work in your community, and we hope everyone enjoys the rest of your day. And as a reminder, if you haven't, check out nmqf.org to learn more about National Minority Equality Forum, and nmqf-shc.org to learn more about the Center for Sustainable Healthcare Quality and Equity as well. Enjoy the rest of your day and have a good weekend, everybody. Thank you.
Thank you.
Bye-bye.